Okay, so in healthcare, a critical challenge is the inconsistent availability of essential blood products due to irregular donations and just people not donating. Hematech Solutions is pioneering a shift from donation based to self sustaining blood processing, revolutionizing reliability and accessibility to these blood products. This innovation expands the production of key blood products in vitro, so in a test tube or in a petri dish, eliminating the reliance of donors, which means a lot, means much more blood product availability, transfusion product availability. The transition ensures a consistent supply, benefiting patients in need of urgent transfusions. Join us in the reshaping of the future of blood processing and transfusion for healthcare systems that save lives and enhance medical practices. So I'm selling a process. So this is not a drug, it's not a therapy. It would be a process of cell expansion or blood product expansion. This eliminates the need for blood donation, so you would no longer need blood donation. So no donating your blood ever again. My process will save time and money while significantly increasing product availability. Blood banks and hospitals will be my main customers, possibly research institutes, so academics, maybe like University of Florida, different research labs. All those places will want to purchase this process and the components of this process because it removes a limiting factor from the equation, being the donor. It creates readily accessible blood products that are ready for transfusion immediately. This not only saves time and money, but it will save lives. I mean, having necessary transfusion products available will save lives. Right now, there's currently no public company working specifically on the expansion of blood cells for the purpose of reducing the need for donors. So competitors that specific are slim to none. Some general competitors in the sector would be cell isolation companies. So people that are specifically isolating cells from donated blood, whether it's peripheral blood, cord blood, bone marrow. So cell isolation companies would be kind of a competitor. They would definitely not want this to succeed. I mean, you need blood products to be able to have an isolation product. So I believe my process is a completely new product that would need to gain trust and traction in the blood banking and clinical community. The biggest hurdle I think that I see would be getting clinical data to prove, the functionality of these cells is not any different than the functionality of cells that you get from donated blood. So you have to prove that expanding them in a petri dish, feeding them, testing on them, freezing them, does not impact the functionality of the cells, which would be difficult. So you need a lot of clinical studies, clinical trials, and research and data, which is a lot of money to really support this process. And it would take all of that for a blood bank to even consider the transition to a self-sustaining versus donation-based process. I would say my inspiration for this company stems from my experience in cell isolation and blood banking industry. I am an inventor of a magnetic stem cell isolation process and pieces of equipment where you're able to magnetically isolate CD34 hematopoietic stem cells from cord blood. So when you have a baby, you can donate your cord blood. And there's a lot of stem cells in that cord blood. And those stem cells can be used for cancer therapies. They can be used privately if you want to keep your cord blood and use it just in case your child becomes sick in the future. But it's a smaller industry. A lot of people don't know that you can just donate your cord blood. A lot of it gets thrown away just due to lack of kind of knowledge of the process. So you can donate your cord blood. And it can mean a lot to a lot of people, and it can save lives for sure. cord blood definitely saves lives. So my inspiration is that I'm heavily in this sector. I see what cell isolation does and the lives it impacts. I've seen the impacts of low donations. When you don't have any donations, you don't have any cells to isolate, you don't have any therapies to create, and that hurts the patient at the end of the day. They need this product, and if it's not available and people aren't donating, then they don't have it. And that's a lot of the times that's their only option, especially if they're immunocompromised and chemo isn't a good option. Stem cell therapy is huge, and it's very beneficial in all types of cancer, where it's like geriatric, adult, pediatric, oncology. Who's your customer? My main customer would definitely be blood banks, possibly hospitals, but I would say blood banks. The stipulation there would be the need for a major shift in operations. So it would be completely shifting from blood banking and donating to self-sustained cell expansion. So it would be a huge shift in operations, a shift in faculty, a shift in training, regulatory implications. It would be a massive change, but if it's going to be beneficial, then those changes are worth it. But that's what I was saying. It would take a lot of time and money to prove that change and transition is worth it. So yeah, it would be a change from donation based to expansion based operations in blood banks, in the community or in the companies that are selling or providing these products to hospitals. A lot of the times this isolation and expansion isn't happening at the hospital. They're receiving it from blood banks, tissue banks, stuff like that. A lot of testing happens in hospitals, not really isolation processes. My customer, user, and payer would all be the same. So the end product, the end person would be to a patient. The cells are going to go to a patient for transfusion. My company would not deal anything with the patient. We are selling a process to a bank, and that bank would have a continual relationship with Hematech Solutions because they'll be purchasing a kit with different components necessary for this expansion. It's a patent kit that has been optimized. We know it works. We've done all the heavy lifting, all the different optimization experiments, and we're selling the process with a kit. So it would be a kind of forever giving relationship where they'd have to continue to purchase kits and keep expanding these cells. So my customer would always be blood banks or the hospital, never the patient or final customer. I'm never going to be selling this product to a patient. I'm not selling cells. I'm not selling blood. I'm not selling a specific material because that would be drugs. That would be maybe a device. It really wouldn't be a device. It would pretty much just be a drug, and that's a no. That's millions and millions and millions of dollars and tens of years to get a drug on the market. Do you have a clear value proposition? Yes. My clear value proposition is to reduce the need for donations, thus increasing product availability, saving money by reducing the need for testing. So a huge financial hurdle currently is when you donate blood, it has to go through all this testing, HLA testing, serology testing, to make sure, there's no diseases present, what antibodies are present, to make sure that whoever you're matched with transfusion-wise is a good match and that it's not going to create graft versus host disease, which is never good. So implementing a non-donation, expansion-based process, you would reduce the need for testing. All of these cells would stem from and grow from a clean, known starting sample. That would hopefully work for everybody. I mean, maybe you'd have, A, B, different starting samples, and you'd be able to pick from those, but you know what they are. And you know that they're clean where they come from, so it reduces that whole level of testing that's required in blood donations. It would save a lot of time, always knowing the products that you have, never running out. It would definitely be easier to manage inventory and to say, okay, we have a product for this person that needs it, and we're able to send that over now. And instead of having to say, okay, well, let's see if we have a donor. Let's check other people if they're qualified to be a donor, and so forth. My customer would be part of a company. So generally, the decision maker here would be a CEO for sure, especially since it has such a major impact on the whole operations of a company. This would definitely be a whole company-based decision. And I think that decision would stem from, I wouldn't say profitability, because a lot of blood banks are not for profit, but on kind of benefits. How is this going to benefit them? What does their revenue look like? Cost versus revenue. Their profit, they could put money back into their bank to do other things, being self-sufficient. It kind of gets rid of kind of the question of, hey, are we going to have these products? It gives them the bonus of predictability, which is very important in the system, or in this sector. So yeah, I think it's a great opportunity, and I think it can help a lot of people, save a lot of lives, and I think it can make really good money. I think for me, in my business, which would be for profit, it would make a lot of money.